The topic of discussion that we'll be dealing right now is we'll be talking about IgA nephropathy or Berger's disease. Now these both are same thing. Now why it is called IgA nephropathy we'll be dealing with short afterly. So the pattern that we'll be discussing is we'll just go toward the content of our first aid at the end of this lecture. So before that we'll be going through all these things, right? And after completing all these things, what we'll do is once we will just correlate these things with the content present in what the present in our Robin. So these things. So now shortly, without delay, I would like to move toward our discussion. So moving right here. Okay, what is IgA nephropathy or what is Berger's disease? So this IgA nephropathy, if you remember what we discussed in the case of in the case of PSCN, right? Post streptococcal glomerulonephritis, right? If you remember the post streptococcal glomerulonephritis, right? This P, we were just highlighting this P and we are saying that this is more prevalent in the case of children's. And how we were remembering that? We were remembering that by just word P, that is pediatric, right? Pediatric. Okay, now so we're saying that this PSGN was what it was more related to what it was more prevalent to what to children's. Now here, right, in children's it is more prevalent in children, or we can say it is the most common cause of glomerulonephritis in the case of children. But this Berger's disease, this B means what? Big, right? The big mean big. That means this Berger's disease is the most common cause of what? Glomerulonephritis in the case of what? Adult. So adults, glomerulonephritis in adults it is more prevalent. Okay, now talking about another thing, right? Now why it is also called IgA nephropathy? It is called IgA nephropathy because there is a large involvement of IgA that we'll be discussing right shortly. Okay, now there are two type of this Berger or IgA nephropathy. Now talking about two types. What are these two types? Two type are, right? It's two or we can say according to the manifestation we can just say that it is of two types, and the two type are the first one is our primary and another is our secondary. Now this talking about what? This is primary, right? One is our primary and another is our secondary. Now this primary, right, here this primary, here there will be the involvement of only kidney, right? There will be the involvement of kidney, right? There will be the involvement of kidney. But in the case of secondary, what will happen is that there will be what? There will be involvement of our liver also. There will be the involvement of our celiac spores also. So here there will be the involvement of our liver also, celiac spores also. Okay, now here, yes, we talked. Okay, now let us move forward. Further, what will happen here is there will be what? There will be initially what will happen that there will be upper respiratory infection. What will happen? There will be what? There will be upper respiratory infection. Now as there will be upper respiratory infection, right, after 1 to 2 weeks, right, after 1 to 2 weeks there will be what? There will be excessive immunoglobulin A. What? Immunoglobulin A level will be increased excessively in serum, right? Now these immunoglobulin A, there is one important thing that we need to know about this immunoglobulin A. This immunoglobulin A exists in two forms. This immunoglobulin exists in two forms. Now one is monomeric, and another is what? Another is our polymeric. Now this monomeric form it exists in serum, and talking about this polymeric form, what? These forms are removed from blood. These are removed from blood, right? If they are present in blood, it will be removed by our liver. This is not present in our normally in our blood. But in the case of our this Berger's disease or IgA nephropathy, this polymeric form will be increased in our in our blood. So since we are talking about what, there will be an increase in what? There will be the increase in what? IgA level in our serum. Now what will happen is this increase in IgA level, right? Now IgA level in serum, it will have what will happen is this immunoglobulin A, right, it will be deposited in mesenterium, right? It will be deposited in our mesenterium of our kidney. So that means this will be now what? This will be deposited in mesenterium. Now why it will be deposited in mesenterium? It will be deposited in mesenterium because in the surface of our this mesangial cell, in the surface of our this mesangial cell, there is our CD71, right? There is our CD71, and this CD71, it acts as receptor for attachment of IgA, right? IgA. So as there is what, there is the presence of CD71 in the surface of mesangium, what will happen, it will, this CD71 acts as a receptor of IgA, it will be attaching a large number of IgA, and this attachment of large number of IgA will cause what, it will cause the deposition of IgA in what, mesangium. So okay, mesangium, right? Now this IgA, right? Now another important feature about this IgA is what is that, it causes what, it causes the activation of complement system. What will cause, it will cause the activation of complement system. Now because of the involvement of alternate pathway of complement system, right? Now since there is what I'm saying is, this will cause what, this will cause, okay, let me use, okay, what will cause is, it will cause activation of complement system. Now talking precisely, complement system, what it will do, it will cause what, it will cause the involvement of alternate pathway of activation of complement system. Now since there is the involvement of alternate pathway, what will happen, there will be what, there will be C3 level what, normal, there will be normal level of C3, right? Okay, that means what we are saying, that there is what, there is the normal C3 level. Okay, now let us move toward the thing that we mentioned, right? Okay, right here you can see what was going on. Okay, we said that this was what, this was the most common cause of what, glomerulonephritis in the case of adult. Yes, from B means big, big means adult, right? Now here what was going on, there was mucosal infection, right? Upper GIT infection, that will cause increase in IgA level in serum. This IgA level, increase in IgA level of serum will cause what, it will cause the deposition of IgA in mesangium, right? And in mesangium there will be what, immune complex formation. Okay, now as there is what, immune complex formation, there will be the glomerular injury, and this will happen, right? Now what, within less than 72 hours of what, the infection of our mucosa. Okay, now yes, now how we will differentiate. Okay, here we are saying that what, how we will differentiate that the condition is PSGN or our IgA glomerulonephritis, because here there is what, glomerular injury in both of the case, and there is what, there is immune complex formation in both of the case. Here also we are finding immune complex formation, here also we are finding immune complex formation. So how we will do is, if there will be the first difference is, this PSGN will be manifestation in children, pediatrics, right? This IgA, it will be manifested in our adults, right? Now here the duration is our 10 to 14 days, but here the duration is less than 72 hours. Okay, now here since we are saying that the IgA in IgA nephropathy, there is what, there is no involvement of alternate pathway, so sorry, there is the alternation in alternate pathway, so there will be what, not reduction in C3 protein or normal complete protein, but here in the case of PSCN, what, there will be reduced in serum C3 level. So this was about what, this was about our IgA nephropathy or Berger disease. Now here talking about IgA nephropathy or Berger disease of our what, phosphate content, what we can see is there will be the presentation of episodic hematuria, right? There will be the episodic hematuria that will usually occur concurrently with respiratory or GI tract infection. Yes, we mentioned about these things. IgA is secreted by IgA is secreted by mucosal lining. Yes, we know IgA is secreted by mucosal lining. Okay, renal pathology of IgA vasculitis will be found in our HSP. In light microscopy we will find mesangial proliferation. In immunofluorescence we will find IgA best IC deposit in mesangium. In electron microscopy we will find mesangial IC deposition, right? Immunocomplex deposition. So yes, here the thing that we are not, the thing that we need to keep in our mind is there is the involvement, it is mainly seen in adult, right? We need to know that we need to know about this IgA, right? We need to know about IgA. The main thing is that we need to know the difference between this PSGN and IgA nephropathy, right? We need to know about this mesangial proliferation, right? Deposition in mesangium, okay, deposition in mesengium of our IgA, right, and that will be demonstrated in our IF immunofluorescence. So this was about what IgA nephropathy or Berger disease. Now moving toward the content of our what Robbins or Robbins, what we'll see is, yes, we'll see that there is IgA deposition in mesengial region, right, and recurrent hematuria is the most yes, recurrent hematuria is found here, and this is the most common type of glomerulo nephritis worldwide, right. Yes, we talked about IgA deposition, why there will be the deposition of IgA in mesengial region, right, and yes, you can see this is the diagram of our IgA nephropathy, right. The above one, it is showing the light microscopic, right. Here you can, what you'll see is there is our mesengial proliferation, you can see right, and this mesengial proliferation will cause the increase in matrix, right. Now here you can see what immunofluorescence diagram. Here what you will see is there is the deposition of IgA, right. Here these are IgA deposited in what mesengial region. Okay, now yes, we talked about primary and secondary one. In secondary one, there will be the involvement of what, our liver, right. There will be the involvement of intestine also, right. We talked about pathogenesis as IgA, right. IgA, it exists in two form, monomeric form and polymeric form, right. This polymeric form was removed from blood or catabolized by liver, right. It was removed from blood by liver. Now but in the case here the polymeric form will be increased in the case of IgA nephropathy, right. Okay. Yes, this was brief discussion about our Berger's disease or IgA nephropathy. So with it, I'd like to end the discussion right here. Thank you and have